Already 3 times.
Surgery done. Na? Remove your specs. You do like this. Okay, open your mouth. Okay, I can correct this. Ita, tongue depressita. Open. Bite. Okay. No problem. Bite. We can correct this and make normal. So they have done some surgery here. Scar is there. I will correct that scar also. We will make normal size lip. Okay. You have to stay with us for 7 to 10 days. One scan we need. You can take the scan. Blood test we need. Anesthesia consultation we need. Once we finish everything, my team, they will tell you the total costing. You have to stay with us 7 to 10 days. We will do total blood test, arrange blood, everything we will do. We don't have to do anything. But you have to stay for 7 to 10 days. 10th day or 11th day, mostly sutures will be removed, whatever sutures are there. Then that tissue we will remove, we will send it for examination, biopsy. We will remove it from the root only. It will not grow again.
Okay.
Sure.
Actually, 3 times are done.
I know I have said you've had 3 times surgery, but see, these are difficult surgeries. And unless you don't remove it by the root, it will slowly grow again.
Right.
But it is not very big for you. It is not going into the upper jaws or cheek and all to a much extent. So we can remove this. And also because they have done surgery before, there is some scarring now. Fibrosis is there. It's good for us. So indirectly, earlier surgery is helping us in some way.
Okay.
So bleeding should be little less.
Bleeding is.
Yes, all that we will correct.
Okay.
Yeah.
Hair will.
Yeah, hair will also come as much as possible.
Okay.
Main surgery is not for the hair to grow, for the shape of the lip.
Right. Main problem.
And hemangioma will be removed.
I've spoken so many times. Last 8 months off. Tamil Nadu is too far out.
Yeah, Tamil Nadu is far. This is easy for you. None.